Hi, welcome to my blog, melindadunn.com. Here we are with Dr. Jason Porter of East Valley Naturopathic Doctors. He's going to talk to us today a little bit about cancer and the link to environment. Thank you for being with us today, Dr. Porter. Can you please tell us, about your practice here?
Well, I appreciate you asking me. I always enjoy talking about cancer and helping patients, but in this practice, we focus on helping patients really to return to health. Often we see cancer patients come in at different stages, and we recognize that environment plays a significant role in the immune system and in fighting cancer. And so we spend a lot of time in this clinic really helping patients to realize the ways in which they are toxic and helping them detoxify. In the end, we hope that this actually improves their immune system and actually reduces the inflammation locally in tissues that might be cancerous for them specifically.
So you treat cancer patients with more of a natural route. Can you tell me a little bit about that?
Yeah, we take two approaches, and one approach is that we understand that patients who actually have cancer, their immune system is not functioning. It's lost its awareness of what's going on. And so first thing we look at is levels of natural killer cells. This is the most aggressive cancer-fighting cell in the immune system. And if those levels are low, which they often are in patients, we will begin to apply natural therapies and detox therapies to help raise those levels. Secondly, we also look at stress levels, and we can actually measure catecholamine's levels in patients to determine how they're handling stress. If they're not handling stress well, we know that their body will produce too much adrenaline, and this shifts their immune system towards favoring or ignoring cancer cells that may be floating around in the bloodstream.
So this is new to me. So when you're talking about stress, you mean emotional stress or physical stress or both?
Oh, of course, both, because obviously we can have physical stress and we can have emotional stress, and it's hard to measure these things, but again, we can measure these through the catecholamines, which are normal neurotransmitters produced, from the brain. And so we have ways of looking at the brain chemistry and helping the immune system improve in its functioning, but we also have the ability to look at the immune system in the periphery, floating around in the bloodstream, and find ways that we can improve both those. Of course, foundationally in both therapies, we do find that as patients detoxify from environmental toxins, whatever they may be, that they improve both in production of catecholamines, non-stressful levels of catecholamines, and they do improve in their immune function. And of course, this helps patients to respond better to therapies, such as radiation and chemo, if they're doing those. But if they're not doing those, of course, we do want to build up the immune system and its ability to fight cancer on their own.
So at what point do you typically start to treat a cancer patient? And on that note also, what kinds of cancers are you finding to be environmentally linked that you treat here?
Well, I'll answer the second question first. It's interesting, but the research is showing that even breast cancer, that there are deposits or pesticides present in breast tissue, and so that's been linked. We know, for example, in prostate cancer that there are viruses that are present that are causing inflammation. And again, we'll probably eventually with time find that many cancers are actually environmentally induced. Of course, we know lung cancer is environmentally induced with smoking, but when you have smoking and exposure to cadmium and lead from cigarettes, you're also going to have potentially asbestos, which will aggravate that at a much greater rate. And so it'll increase that risk. So those are things that we look at trying to reduce in a patient if they have those exposures. So we can do chelation therapy to remove heavy metals, or we can do detox therapies that are associated with very specific supplements we do, along with helping the liver flush and move toxins. And those will keep and get rid of those pesticides and those metals. In the end, we hope that patient will be able to reduce their overall risk. A patient has to have a risk for developing cancer before they develop cancer, meaning they're prone to it. And so we want to reduce their likely expression of cancer. Now, sadly, most cases when we see patients, they already have cancer. I wish we could see patients much sooner. If someone had a family history or risk of cancer, such as breast or colon or prostate, wouldn't it be nicer if they came in 5 or 10 years before a potential diagnosis and would detox? And we know, and there's studies indicating that those with the lowest levels of toxic metals have the lowest cancer risk. And
Wow.
interesting, even their risk is 10% of that of the average, which currently is almost 45 to 50% on average in the U.S. So that makes a big difference to be able to detoxify. The cleaner we are from the inside out, the stronger our immune system is. Locally, we won't have toxins concentrating in tissues, meaning they're not going to also cause local inflammation and irritation leading to cancer. So we know it makes a difference. We just need to start earlier and be more proactive about it, for sure.
Okay. So you treat patients here, and can I hear some success stories?
We have many success stories, and obviously in this clinic we use more than just nutrition as a foundation or support of stress catecholamines or immune stimulants. We also do high-dose vitamin C. We use also other natural products such as naltrexone or mistletoe that you can order and get out of Europe. The most common European treatment for or alternative support for chemotherapy and radiation as patients go treating their cancer. These are all things that we can do in this clinic, and of course we'll do a combination of things. But when you apply those, we've seen tumors reduce in size by a third or two-thirds within just a period of 2 to 4 weeks. And it all depends on how advanced the patient is. Of course, it becomes more difficult when a patient is a stage 4 or if it's metastasized to multiple locations. But we are able to work with patients as they work with their doctors doing chemotherapy, radiation, or if they have failed those therapies, we have therapies that can assist them while they're trying to get rid of their cancer.
It's very interesting. For our viewers, can you tell them a little bit about the mistletoe?
Well, mistletoe is obviously it's been researched for many years and used in Europe, and believe it originated out of Germany. But they are injections that just again have shown that stimulate the immune system and the immune system's activity and awareness, so that the immune system's fighting. All the research shows that if we can get the immune system working and alert to what's going on, that it helps fight cancer generally without chemotherapy or radiation or surgery, but certainly it can even increase the effectiveness of those therapies as the immune system's awake and alert and alive. And that's really probably the main issue in most cancer patients, is their immune system is just asleep. So we're just trying to wake it up.
So our immune systems are asleep because of various reasons. A lot of it's the environment and what's being put into our bodies, and just kind of suppressing that immune system. So then, yeah, that's very interesting. Thank you so much for sharing that. Do you have anything else you'd like to mention about cancer treatment naturally?
Well, I think I know there's a lot of confusion. A lot of doctors who do standard allopathic treatments such as chemo and radiation have a hard time incorporating or letting their patients incorporate natural medicine at the same time, thinking it will interfere or get in the way. And mostly it's just a concern about not knowing what it is and what it will do. But there are numerous studies done by other oncologists who are mixing both chemotherapy and radiation with alternative medicine and showing extending life, a 5-year survival rate by 50%. And so this is an exciting thing that we need. If patients knew that they could apply even both therapies simultaneously, they do improve their chances of living longer. And that's what the research is showing. And so I don't know that many patients know that they can do both. You don't have to be one way or the other. You can actually ride down the middle and kind of do a little bit of each. And it really is in the patient's interest. Of course, a lot of those therapies are designed to help them detoxify, which helps them detoxify from the chemicals and things that they're being exposed to. And so they're going to feel better. They have more energy. They recover better from treatments. And their 5-year survival rate will increase and easily double for most patients. And that's exciting.
Can you touch briefly on the rate of patients getting cancer again after they've had it treated through radiation or chemotherapy?
Yeah, sadly, of course, we see today many patients, once they have been supposedly given a cure, or their cancer seems to be clear, or it's gone, the tumor's gone, and everything seems clean, sometimes within a few weeks, a few months, and even a few years, we'll see that tumor or that cancer come back, maybe in the same location, often in another location. What that means is the cancer never was really gone. We suppressed it long enough with chemotherapy and radiation, but it never really went away.
It kind of makes sense if the body was never cleaned out, and that was maybe one of the factors in the beginning. I can see that.
Yeah, that's correct. And so that's why I think it's even more important for patients to realize that that their body is prone to developing cancer. And even if they have successful treatment, following that successful treatment, taking a proactive approach about detoxification and about immune stimulation will guarantee that they'll live a lot longer and will keep that cancer from coming back. And of course, that's a great goal. You consider all those who have gone through therapy successfully. We want them to make sure that they don't have to fight this again, since they've already done it once. How tragic it is to have to do this twice or even 3 times in some cases. So we know that, again, detoxification and immune stimulation through natural medicine can help guarantee that that will not come back again.
Can you tell me how patients find you? Like, they have cancer and they're trying to come up with a treatment. How do people find you?
Well, we do our best to put information out on the internet via just our website. Many times, again, patients are just Googling, about their cancer specifically or alternatives. Of course, we do high-dose vitamin C IV or high-dose vitamin C in IV therapy. This actually has been shown to kill cancer cells, and this is a very popular therapy that many people know about if they are doing any research on the web and such. And so they will Google that idea and find us locally. And of course, those are therapies you do in-house, in our office, in our IV room. And of course, most patients are looking for somebody who can do that for them.
You make house calls, is what you're saying?
Well, we do. Patients come in. We have patients come in to do IVs here, and most times they usually have family supporting them when they come in. So
when I was thinking to myself, let's say there's a person in a hospital being treated with chemo, or maybe they are going from their home to the hospital to get chemo. I didn't know if perhaps there was a service you provided where you visit them.
We don't have that set up at this point, and that's difficult. And most hospitals do not provide vitamin C IV as an option if they're hospitalized or if they're in that position. Sadly, most patients have to make that trip or support. Usually we try to line that up so they do one therapy and then they come here to do the following therapy, or they alternate days, so that they can kind of have a little bit of each as they go through that.
Well, thank you so much for sharing this information with us. Is there anything else that you'd like to add?
Well, I just want to thank you for letting me share, and we hope, as a part of this process, that patients begin to realize that they have more options, and that it really is in their interest to learn all they can about what they can do, because in the end, they will be better off, and we'll be able to extend their lives if they apply both ideas, if that's what they choose. So thank you.
Absolutely, thank you for being here. Can you please tell the viewers where they can find you?
We are located in Mesa, Arizona. Our address is 5416 East Southern Avenue. Our website is eastvalleynd, as in NancyDavid.com. And viewers can get on that website and kind of see the doctors and see the therapies that we do. And that's probably the best way. And they can call our office staff, of course, with questions.
Okay, great. I really appreciate it. Thank you so much, and many blessings to you as you help these people get healthy.
Thank you again. Appreciate that.